Welcome to our Learn Community Education webinar today. I'm Dee Childers, founder of Life Changes Elder Care Consulting and Vice President for Learn. Today, our topic is the differences between Medicaid waivers. This content is provided for general informational purposes only and is not to be considered legal, financial, or health advice. Please consult with your professionals before taking action based on this information. And today our presenter is Mary Spears, a support broker and also owner of My Doodad. And I'm so pleased to have you with us today, Mary. And I would like to just introduce you to the group. Mary is a fourth-generation Idahoan and third-generation caregiver who was raised in a group home with 9 disabled adults. Growing up, she volunteered as a bowling coach for the Caldwell Eagles Special Olympic team. She read for the blind and delivered Thanksgiving dinners and Toys for Tots to people with disabilities throughout the Treasure Valley. In her professional career, Mary has been a direct support personnel in home and in community settings. She's worked in group homes, was a house manager for a 6-bed assisted living community, and since 2012, Mary has been a qualified support broker with the DD self-directed option. In 2015, Mary founded My Places Community Events, which is a nonprofit providing community activities for people of all ages. I'm so happy to have you with us today, Mary, and thanks for being here.
So our last presentation, part 1, was talking about the benefits and the things that somebody could start the application process for when they have support needs. Today, we're going to talk about the third part of that section, because we talked about income, we talked about medical care. Now we're going to talk about those support services, the things that encompass our activities of daily living, the things we all need to do to stay alive. And this is important because I think all of us like life, and life is better when we have supports. And you know, my whole thing, everyone deserves support. Not everyone has the same support needs. Not everybody deserves everything they want. At the same time, everyone deserves support to live a happy and healthy life. So we're going to talk about the difference between Medicaid waivers. When you think about support services that help with activities of daily living, you're going to have, in Idaho, we have the Medicaid waivered services of the Aged and Disabled Waiver and the Developmental Disabilities Waiver. Each one has their own application process. And it's not that you apply to Medicaid for waivered services, you have to apply for each waiver separately. And then we're going to talk a little bit about how to choose what waiver is going to apply to you best. So we're going to look at each waiver, how they were designed, and what's going to work, explain the gist of what is available so you can be in charge of deciding what supports are going to be helpful for you in your situation. I cannot tell you what is going to be best in your situation. You are the one that needs to decide what supports you need, be okay with getting them, and work with building and creating a team that's going to help you be successful. It's okay to need support. It really, really is. I have a ton of amazing support and could not do any of the awesome things I've been able to do without the support that I have. And if that means that I get the opportunity to help you understand how to get the supports that you need, that is just, it makes me happy to be able to share this information so that people and yourself can get what they need to not just live, but thrive.
I like to say that asking for help or support is a strength, not a weakness, because many of us default to not asking and run ourselves to the ground. So be wise, ask for help, ask for support.
Okay. So as we talked about in our last session, the what and when matter for when you have support needs or become disabled. Whether or not it's an accident or injury can determine, what supports you're going to need. If you lose your leg, obviously you're going to need either a prosthetic or a wheelchair. If you have a traumatic brain injury, you're going to need more supports that help with the cognitive function of daily activities. These are going to drastically change the types of supports you're going to want to get. Or is this something that's wrong with your chromosomes or different? But I don't think wrong is the right word. Are your chromosomes different? They decide to split in a random way that we haven't seen before or that we have seen before, and we know that people with this change are going to need more support. Okay, if it is that way, let's find a way to get you what you need so that you're not just cycling in and out of crisis. When this happened is important. Like I said, was it at birth or was it after you turned 22? Generally, by the time someone is 22, they have worked some jobs, whether it be part-time, whether it be full-time, whether they've done school, what have you. The powers that be, because I'm not completely sure, have determined that at 22 is the cutoff for the Developmental Disabilities Waiver. So your diagnosis has to predate your 22nd birthday to qualify for that waiver. I think it has to do with some of the resources that you had available prior to becoming disabled. And if you don't know what's wrong, that's okay too. Because maybe, like Dee said, you need to ask for some help. Because what if it's that you're stressed and need to see a counselor? Well, let's do that. Having documentation whenever you apply for services is your best practice in getting approved the first time. Don't be afraid to reapply, and always make sure that the information you supply has your full name, first, last, middle initial, date of birth, social security number, qualifying diagnosis, address, email, and phone number. Those things are going to be very helpful in making sure that they get the right information to the right file. Because my name is Mary Kay Spears. My mother-in-law's name is Mary Frances Spears. Very important to know whether it's Mary Kay or Mary F. when doing things with my family. So, documentation that can be used when submitting for services involves accident or injury reports, whether it was from the employer, police officer, EMTs, hospital, what have you. Those records are from qualified professionals within their scope to be able to say, yes, this person has this diagnosis or support need. Medical records include that as well, from your primary care physician, so on and so forth. Letters from family or friends or school records are very important as well to establishing that baseline of support need and why we're applying for these services.
So, Mary, as we've talked about before with documentation, and both of us have a strength in that arena based on our careers, is that, you know, when you start the process, to have like a 3-ring binder with dividers so that you keep yourself organized and that you can quickly flip to the section. Medical records go here by date. Other reports go here in a special report section. Whatever the documentation is, try to keep yourself as organized as you can so that when you're on the phone with somebody, that you can quickly reach that information you need at hand.
That's a great idea. I am younger and therefore more digitally inclined. And so my binders are usually organized file folders on my desktop.
Electronic or hard copy, whatever works for you.
Whatever it is,
I agree with you.
Sure.
I
think having a hard copy backup is actually best case practice or best practice, because let's face it, power outages happen, viruses, there's a lot of things that can go wrong with technology. Having a hard copy binder backup is a very good idea. It's, you know, and whatever works best for you. Some people are much better with pen and paper. Some people are really good with their computers. Do what works for you is my big thing.
Well, and I agree with you. There's so much that we don't know. We do live in a wonderfully electronic world, but we also live in a world where stuff goes down, power goes down, internet goes down, and we do have to be mindful of that. So for my clients, we have all of our data is electronic, but we have hard copy paper files that include a summary report of everybody's medical information and medications and key providers. So you have to know that there's some information you may want to have for sure hard copy.
Of course. That just makes me want to do a pitch for my data diary, honestly.
Well, which is a great tool.
It's a great tool. Love you, Dara. Anyway.
Yes, we do.
So we're going to start with the Aged and Disabled Waiver. The Aged and Disabled Waiver, the Idaho Aged and Disabled Waiver, Medicaid waiver, let me not say that. Let me try that again. The Idaho Aged and Disabled Waiver, also known as the A&D waiver, is a program that provides an alternative to nursing homes for people who are aged, blind, or disabled by providing nursing home level care services to people in their own homes or community. The A&D waiver will also pay for services in an assisted living community, such as a ResHab, or residential assisted living facility, or also called a RALF, or a certified family home, CFA. This is really important. Multiple studies have shown that people do better when they don't feel like they're in a cage or, shut up in an institution. Funny thing, people do better when they're in their own home or when they're in an environment that they enjoy being in. Who knew, right? So they've also shown on multiple studies that providing these services in the home setting really can reduce costs and increase the effectiveness, because people are more likely to utilize a service in their home than in an institution or in a nursing home.
I have a quote that I like to share with people here, which is home is not a place, it's a state of mind. So home can be many different places.
Right. And that's why things like the Certified Family Home Program exist. It is to give that home environment and that sense of family and care. So the requirements for this program is 65 years or older. Now, you can apply for the A&D waiver if you are 18 to 64, as long as your diagnosis is determined by and recognized by the Social Security Administration. So that is important to know. The other requirement, other than age and diagnosis, is the nursing home level of care. This means that you're going to require supports in your activities of daily living. An activity of daily living is anything you need. So it's eating, it's drinking, it's meal prep, it's walking, ambulating to and from, it's assistance in the bathroom. And not a lot of people like to admit when they need help there, but if you need that support, it's much better to get it than to get infections or sick. So that is, and I'm sure Dee, is there any other specific things for nursing home level of care?
No, it really, assistance with the activities of daily living is kind of how we look at it. The ADLs and the IADLs are the key there.
And then applications can be done online, in person at Health and Welfare office, or over the phone. So there's multiple ways to do that.
The one piece, and maybe you're going to cover it later on, but I always found amusing, is that the forms from the Department of Health and Welfare don't have boxes for you to check as to which waiver you're applying for. So you do need to put the age and disability waiver on the top of the document that you're submitting to Health and Welfare.
That's good to know. The DD waiver application does in fact have that.
The A&D does not.
That's an interesting oversight,
isn't it?
Anyway, so there you go. Everybody, make sure that you list the program you want to be applied for, or that the application says the program you're applying for. So once you apply and you get approved, what can you get? Well, you can get day health or daycare. Now, adult day health or adult daycare, these come in different forms. What type of day health programs do you find really beneficial for people?
Well, to be able to go to adult daycare, and we really only have one official one in the Valley, but what I do find is many of the senior assisted livings, especially if they have memory care, will do accept someone for 2 to 4 to 8 hours a day, but that depends on the community themselves.
All right, so that's obviously that's a need that that would be fun to develop in the community. Good to know. Residential care, again, that comes down to like a RALF, a residential assisted living, or a certified family home. The A&D waiver will pay a daily rate for the person based upon their support needs. And that's why back in the other presentation, we talked about eligibility requirements. We also talked about during the application process, you're going to have what's called an intake evaluation or an eligibility. And that's going to be for A&D waiver. That is with the nurse reviewer at long-term care. And the nurse reviewer at long-term care is going to go through your documentation and create a support plan that will calculate how many units of support that you qualify for your care. And so that's how that process works. And that comes into attendant care. If you're living on your own and you don't need necessarily you can still live in your own home, you need someone to come help with chore services or personal care, meal prep, things like that. The A&D waiver will pay for that. Meal delivery services can be covered with the A&D waiver. I know, trying to think of the meal waiver. I know Meals on Wheels can be utilized. I know that there's a few other different senior and meal preparation services that you can get. I've had varying enjoyment of the different foods that are offered with those programs. So you might need to try the different things available to determine which one fits your palate.
Yes.
Non-medical
Unfortunately, they do kind of come and go, but we do have a few that have been established in the Valley for a while and do provide a good job, do a good job. Tasty food.
Tasty food. Cool. There is non-medical transport. So for example, if you want to go shopping, or if you want to go to an activity or out into the community, there's personal emergency response systems. Those are basically the watchdog or the classic medical alert devices. Those are covered with the A&D waiver. Consultation services. I believe that's your arena, isn't it, Dee?
Well, yes, though they don't cover us directly. So I think it's really through some of the dual eligibility healthcare programs. They have some consultation services there. They typically don't cover care management, which is unfortunate because we make a big difference. But
this is why having good interdisciplinary teams and understanding fee for service is not the optimum model for delivering healthcare services.
Right.
Residential habilitation services. If somebody has aggression or sundowning with Alzheimer's or combative behaviors, residential habilitation services can be helpful for counseling and for helping educate providers on how to assist those people in those situations. And then there are self-directed services. I am not as familiar with the A&D waiver self-direct. I do know that Living Independent Network Corporation is a great resource for that.
You cut out there just a second, Mary. What did you say was great?
Link, LINC,
Yes.
Living Independent Network Corporation. They are a great resource. Actually worked for Link for many years as a personal care attendant. So in people's homes.
Nice.
And this is why my back is special, because when you're 6'3", they like it that you can stand pivot other 6'3" individuals. Yeah. Anyways. So any thoughts, Dee, on anything else someone might need to know about the A&D waiver program?
No, I think I mean you've touched on a few of the things, like there is a income level requirement. There is an asset level limit. Typically, you can have your own home, and either you or your spouse must live in the home for that to not become an issue. You can have one car, and that does not disqualify you. So I do find people get a little bit confused about that. So that is not a disqualifying event, and that it is set up so that there is not you don't impoverish the spouse who doesn't need this care in order to qualify for it. So there is something called the Spousal Impoverishment Act that prevents that from happening. And
Wonderful.
important to aware of, as well as we mentioned in the last presentation that there are tools out there to help with, just being right at an income limit threshold, something called a Miller's Trust. And there are great attorneys in our market, and I'm sure in any market, that can help you with all of that, to make sure that, applying for Medicaid is really a very specific event. And then if you have VA benefits, you want to make sure that you're applying at the right time for the right things. And that really is outside, I think, both of our scope. So that's where a great elder law attorney can help you with that. And they need to have some certification and specialize in that area. So we have those. They happen to be members of Learn. So you could probably go to the
We
Learn
have some
website.
amazing members in Learn. I love it.
Absolutely.
I love it. It's great.
We have
All right. So yes, this is the general overview of what I know as not my waiver that I am specialized in. So it's very important to kind of see that. Now, I almost did these side by side, but I was realized there's way too much. So we're going to talk about my specialty area, which is the Developmental Disabilities Waiver, or DD waiver. The Developmental Disabilities, or DD waiver, is a program that provides home care and community-based services to adults and children who have been diagnosed with a lifelong developmental disability, cognitive impairment, or related condition. This refers to those individuals who have always needed that extra support since birth. There are pre-qualifying conditions. There are 4 pre-qualifying conditions for the DD waiver. There is autism spectrum disorder, depending on whether you're level 2 or 3, is a pre-qualifying condition for the DD waiver, as well as epilepsy, cerebral palsy, and chromosomal disorders such as trisomy 21 Down syndrome. So if you function with any of these impairments, disabilities, what have you, if you need supports for these things, you can apply for the DD waiver. You can access the DD waiver services without Social Security. If you are in the middle of fighting with Social Security for your benefits, for your disability income, and you can't get the documentation or show them the evidence they need to approve you for disability income, you can still apply for this waiver services and start getting these services and be assessed through the state while you're waiting for the federal program. It's very important to understand that, because I know some parents get very frustrated when they're assisting their children who have become adults. They're like, I can't get Social Security. That means I can't get this. I'm like, no, they're, again, separate programs. Just because they are all benefit programs, whether it be needs-based or entitlement, they're all through separate systems. And the thing that I will reiterate that I feel will be the best piece of information to give everybody applying for services is always keep your originals and always date and understand every different program does not change documents. You don't have one file with all of these entities. Each entity has a file for you. And you need to supply and make sure you're advocating and getting the data and information they need for your file. And again, just because you have a certified family home and you're talking to them and getting that information does not mean that it's going to the DD waiver program. They're separate. In fact, on the A&D waiver, they're separate.
I love your grandfather clock analogy. Would you use that to help people?
I will. So as a plan developer, when I first sit down with somebody who's looking for support services, think of your services like a clock, grandfather clock, because it's easy to visualize that. Now, everyone's clock is going to be different. So everyone's services are going to look different. You can have yours be, classic Victorian, or you could be like a new age retro one, whichever you want your clock to look like, go for it, right? But when we open up our clocks, everybody's going to have the same, you've got your gear shaft, which is what's going to power that clock. That's going to be your documentation, and that's going to be your motivation and your needs. That is what's powering this clock. Now, as it turns, you're going to put gears in that add benefit to it. Now, with some clocks, if you have all the gears together but one, it might still work, but the date turn might not work. You have to, when you see one part of your clock not working, it might not be your whole clock. You can have one part of your services working and another part not, and it's because they haven't been put together in your support plan. So and sometimes you don't want them to interlock. Sometimes they need to be on separate systems, or sometimes they need to be connected to other ones to work properly. And this can get overwhelming to anyone applying for supports. And that is what plan developers are for. That is what a TSC and a support broker do. We sit down with you and we say, okay, what gears do you need and how are we going to put these in here to work? And how are they going to support you? So whenever you think of services, remember, don't get frustrated if the clock's not telling time. It might just be one gear that's not working. Everything else is. So keep your documentation, make sure you have it, and make sure that you just, when you're asked for it again, just send it again. Send it to, you've got to send the same stuff. Dee pointed out, having that binder with all the different things, make sure that you're sending the same information to each file place, because the last thing you want is for your medical equipment to not have the documentation about your adaptive equipment. You might not have the need for a wheelchair. That's not going to help you get your wheelchair. Whereas if you are a fall risk, you might want the personal response system. You want to make sure that you're very transparent in your support needs. And this goes again with that pride and the stigma against people with disabilities. And I'm just going to say, everyone deserves support. And it's okay to get the support you need, because when you get the support you need, you succeed. I like that. When you get the support you need, you succeed.
Nice.
Cool. All right. So the requirements for the DD waiver are a person whose disability surfaced before the age of 22. I am not sure who made that distinction, but that is the rule. If you were out drinking on your 21st birthday and got a traumatic head injury because you let your stupid friend drive you home, you could apply for the DD waiver. That's a bad example, but it happens. I I have met some really just heartbreaking stories about parents who were super excited to see their kid go off to college, and because of an accident, they're now home and wheelchair bound because half their brain is gone. And these were, straight A students. And it's devastating.
Absolutely.
Also, then the parents that have raised them since birth with these high support needs that are just exhausted. So all programs, the needs require a combination of special, interdisciplinary, generic, and treatment and care service supports. So as I said, it requires that looking at that clock. You have multiple gears interplaying here. Remember on the A&D waiver, we were talking about, hey, grandma just might need some help with meals. That's not a huge clock of services. Grandma just might need help with meals or housework. And that's what the A&D waiver was built to provide. The DD waiver was built to provide all these, PT, OT, behavior management, developmental speaking, all of those things interacting together. They require services that will be lifelong or extended in duration. If you are on a motorbike accident and you hurt your leg and will be on crutches for like 3 to 6 months, then you'll be able to walk again and maybe some rehab, you will not qualify for this waiver. And also it requires that these services are individually planned and coordinated. I think that all support services should be individually planned and coordinated. Maybe that's where you need to think about your own gear shift for your clock, or your own, drive shaft for your clock. This is about your life and the supports you need to succeed. So make sure that they're going to meet what you need. Is that any questions that you have on requirements, Dee?
No, I think that's clear.
Okay, cool. Services. There's a lot more services available on the DD waiver, and that's because they're meant to encompass the entire life's journey of this individual who will always need these supports. So you've got targeted service coordination or plan development services. I am a plan developer as a support broker, and TSCs are generally licensed social workers that work with an agency. A really good agency to talk with if you want to go into traditional services. And I didn't get into that because that goes everywhere. Unbefuddled is a really good place. Advanced Services is a really good developmental disabilities agency. And on Health and Welfare's website, there's a list of developmental disability agency providers that can all assist you in that plan development. And if you apply for self-directed services, then you can find a support broker that will walk you through this journey. There's residential habilitation. That will cover reshabs or someone who wants to live in their own apartment and then have supports come in and help them. There is respite care. I don't like that. I don't feel that that's accurate, but this is what it said on the Health and Welfare website. Respite care is alternate providers from friends and family. You can hire or utilize people that aren't direct family members for care. And there are respite agencies, and there are certified family homes that provide respite services where you can take your person for the day to go hang out with friends or go or just get a break to go to your other job. Because some parents still work another job, full-time job, with taking care of their adult child or your friend or your sibling. Non-medical transport is covered. Under self-direction, you have what's called mileage that can be added into the support plan. So when a person utilizes an agency for the direct support staff or uses self-direction to direct support staff, both of them have a code where that staff can bill mileage. Only for non-medical. understand if you need medical transport, that is through the vendor who has contract with health and welfare. So any medical transport, any to and from hospitals or counseling, that all needs to be, if you're going to have the state pay for it or utilize services, that needs to be done through their who they have the contract with for medical transport. So understand the difference between medical and non-medical transport. Specialized medical equipment.
So before you move on,
Oh,
so
okay.
there is medical transport,
Yes,
but you have to coordinate with a specific office to get that.
correct.
Okay.
Which can be interesting.
You're so PC.
I can just smile. Yeah. It's interesting. Specialized medical equipment, or durable medical equipment as it's also called. These are Hoyers. These are wheelchair ramps. These are wheelchair lifts in vehicles. These are grab bars. These are adaptive silverware, spoons. These are sensory games. These are Dynaboxes. Those are all specialized medical equipment. And so if Medicaid or the insurance provider will not cover that specialized equipment, the DD waiver can cover that equipment. So from self-direct standpoint, again, what I know best, from a self-direct standpoint, when I put durable medical equipment on someone's plan, that usually means we have to have a denial from Medicaid, but Medicaid will not cover that service. Medicaid will cover that insurance through their medical insurance, do it through Medicaid. If for some reason Medicaid will not cover the wheelchair lift, and you can show that they don't have the wheelchair lift, you're putting the person at health and risk, or their staff who's transferring them in and out of vehicles, you can add those onto a self-direct plan. And then on the DD waiver, there's other applications you can apply to get DME as well. And those would need to be through authorized Medicaid contractors. Home meal delivery, similar to what we have on the A&D waiver. You can get meals delivered, or you can have your staff teach you how to cook or assist you in cooking. There's lots of ways to help somebody eat or learn skills to eat. Adult day health, they're also called development centers. So Advanced Services has one, High Valley has one. There are a lot of really good development centers, and I encourage, if somebody thrives in that school environment, they go in, they go to that thing for the 6 to 8 hours a day, and then they come home, do their evening routine, repeat. That's a great place to utilize development centers. If the person doesn't want that type of traditional service, like school or like a group setting, because most development centers now, in fact, pretty sure all development centers only have group codes for billing. If they need one-on-one, or if they want to work on job skills, or if they just don't do well in groups, you might look at the self-direct option to get support staff in there to help them spread out from that traditional day in, day out model. That makes sense? I like your kitty.
Thank you. He likes to come join me at work.
There's a reason my door's shut. Because my puppies would come join me too. Behavior consultation and crisis management. There is an entire section of health and welfare that helps with behavioral management and crisis support. They will help with people who have intense behavioral needs. They'll work with counseling. Crisis management will have trained staff that can come in to help people who have aggressive or intense support needs. And honestly, you roll the gambit. Like some people don't have any like high support needs. Some people just want to have a good time and kind of go day to day. And some people just are angry or frustrated, confused, or we're finding a lot of people on the spectrum are just getting really overwhelmed by day-to-day things that wouldn't bug the rest of us. I know that people who have dual mental health diagnosis benefit from the DD waiver, going self-direct because they can get their mental health services as well as their developmental services. And understand in Idaho that if you have mental health issues, that's another section of health and welfare entirely. And it has its own application. And I am not as familiar with the mental health services, but you can get those through agencies such as Pride Mental Health or other counseling services that deal with mental health issues. I also know that Idaho does not have any mental health institutions that will do long-term support care for people who have a cognitive impairment diagnosis. And that is a real hardship for people who have both. And if you find yourself in that situation, I encourage you to reach out to counseling services and look at the self-direct option to get those qualified HI or habilitative interventionists along with your community support workers to kind of do a wraparound to do the mental health and developmental care because it's very specialized. Developmental therapy. No, developmental therapy is teaching people the skills necessary to do their own ADLs. I'm going to say it can kind of be frustrating as a provider being said we need to teach them these skills. There are some people, no matter how many times we teach them, they're always going to ask us every morning if we put the butter on the toast before or after we take it out of the toaster. It's just how it is. And when they're little, when people are little with disabilities, they're cute. When they're 30 and 40, it's not so cute. And I think this feeds into why we don't have as many adult services, and it's hard to get providers in this arena. So developmental therapy, we're going to keep teaching them as much as we can. And sometimes they'll get better. We just have to watch and keep good documentation of what's improving and if anything is not or falling. For our services, obviously, we don't want anyone's house falling down around them. Have had incidences where this happens because the person doesn't know to dry up floor after they shower. And then you fall through, and it's just bad.
Wow.
Supported employment, job coaching. There is some great things that people who need those cognitive supports make great employees because they're physically able to do every task. They just need someone to help them know what list to do it. Environmental modifications, again, ramps, inside the house, grab bars. Some people have security systems because of elopement risks. Personal emergency response, again, help at fallen. Nursing services, again, the DD waiver is qualifying people on mostly their cognitive ability to function. Well, sometimes that comes with also health issues as well. And so nursing services can be if the person has become diabetic or is diabetic on top of being epileptic. Nursing services can be added either daily, weekly, monthly, quarterly, to make sure that that person is maintaining their health standard as well as their cognitive abilities. Community crisis supports, again, that kind of goes in the behavior consultation and crisis management. Crisis happens when you don't have consistency, by the way. Consistency is key to a good care plan. So being able to come in and support both not only the person, but their team is really important. And then, as I've kind of gone, self-directed services. When you apply for the DD waiver, you can choose which one you go for, whether it's traditional services with the TSC or self-directed services with a support broker. And then, like I said, those kind of filter, and they have different ways of writing up the individual support plan or support and spending plan, which will determine how you get these services. Just like the A&D waiver, there's an eligibility where you have an annual assessment. Annual assessments are done with Liberty Healthcare, and Liberty Healthcare will come in, and instead of units like the A&D waiver does, Liberty does a assessment budget. Now, the annual budget, this is very important. First thing we need to always remember is this is taxpayer funded. And so we need to be responsible with these funds. When you are assessed a budget, if you need to use those funds and you need to use all of them, by all means do so. However, if you don't. If you can pay your staff what they need to be paid, and there is money left over from your assessed budget, that money doesn't go away. That money is utilized by someone else on the program. And for years, I have heard people like, if I don't use it, I'm going to lose it. I'm like, no, it's not like that. This is funds that we're utilizing. When we don't utilize them, someone else who needs these services utilizes them. And I maybe got way off topic of some of this, but this is the waiver I actually know.
Well, and I appreciate that, because this is, sometimes people take entitlement to mean I get to spend all of this, and it really is need-based. What do you need to do in here? Sorry, my cat's deciding to stretch right now. Hopefully not in the picture. So yes, I think that's a very important part, is don't use money that's not needed.
On the same token, if you need more support than you're being assessed for, get the documentation and show them what you need. I feel. Go ahead.
Mary, you raised a point that kind of helped me with some of this, because you're assessing assessing needs, and these are some of the needs that can be assessed that you need support with, but you get dollar amounts based on that. You're not necessarily, other than maybe non-medical transportation, where there's a number you call. There's most of these things, you're managing most of this on your own once you're funded, correct?
So for the process, you apply for the DD waiver. You've opted into whichever traditional or self-direct, whichever one you've chosen. You go through your assessment with Liberty and they give you a budget amount. Once you have that, then you meet with your plan developer. You meet with your TSC, or you meet with your support broker, and our job is to put that money in the boxes. So there is a personal support box. There is a transportation box. And then our job is to do a lot of math and write goals on how this funding is going to be used to support this person's independence. How are these fundings going to teach people to do better for themselves? And that is the crux of developmental therapy, is aligning goals that are going to help people become as independent as possible for them. And that's why every plan has to be individualized and different.
It's different than the A&D waiver.
Very.
We don't have to do all of that. And so that's why it was like, oh, that's kind of a new way of thinking about it. So it is very different.
Mm-hmm. And I have seen people who choose the A&D waiver with a high support needs, their adults offspring who has high support needs, they've chosen to use the A&D waiver and then wrap around state services for PCS or people to take them out into the community.
Mm-hmm.
I have seen people put all of their supports into their self-direct plan. I have seen people only use the traditional services to pay whoever they're living with as their certified family home. And they do one, like they have a personal emergency system to keep themselves on the waiver, but that's all they really need. They just need a roommate to make sure they don't fall if they have a seizure, and they can pretty much function. There's a huge spectrum, and I know that's a word that kind of brings on other connotations, but there is a variety of levels of support people need. And it's important, again, or do you have a Rolex on your wrist, or do you have a grandfather clock that you need to manage? And making sure that your team is aware of how that's all going to interplay is really important. And I love my job as a support broker. I love helping people build that plan that's going to enable success. And I've told people I started a nonprofit doing fun things in the community because I'd get these families all set up and I'd never see them except for plan development meetings because they had all the supports they needed. They didn't have to come back to me. So it's like, wait, I don't see you ever because we have everything working. You're cool and I want to hang out. Let's go do this. Like I joke that's jokingly, but I started the nonprofit as a way to add a community aspect to the self-direct option that would give people an ability to go and meet other people on that program. Because again, if you hadn't been here listening to me talk about self-directed services, you wouldn't understand the process or the things available to the people. And again, if they have a support person, what do they do in the community if they don't have an adult day health setup that they go to?
Right. Exactly.
Let's see. Is there another slide? Students.
Excellent. Well, Mary, another fabulous presentation. Thank you so much. Yeah.
I hope people have learned a lot, and if at least you've learned what programs look like to determine which one's going to fit your situation.
Thank you, Mary, so much for your presentation today. It was such a great bit of information that you provided us, and I know we'll look forward to hearing from you again in the future. If you enjoyed the presentation today and would like to know more about what Learn is doing, we encourage you to sign up for the Learn mailing list. We will only send you one email a month, and that will let you know what new recordings that we have out there. Once you sign up, you must also confirm your desire to become a member of the mailing list. So be sure you check your email and your junk mail for that confirmation email. We will not send you any other email unless you confirm your choices. We have more than 100 topics out there in our video library and encourage you to take the time to explore the topics and the videos and the professionals that we have out there. On our Learn website, we also have a listing of our members' directories with their expertise and the ability to be able to find resources that you might need in the community. This is the Learn mission, vision, and purpose. We encourage you to spend some time. We value this as a great resource for family caregivers, professional caregivers, and those who are just kind of approaching the subjects of needing to do some caregiving. So again, thank you, Mary, and to all of you who are watching this video presentation. We appreciate you greatly. Have a great day. Thanks. Bye-bye.